Good evening, everybody. My name is Adrian Talley, and I am the Superintendent of Indian Prairie School District, and I'm very happy to see all of you who are here tonight to participate in our Parent Academy. Our Parent University webinar on mental health. This is part of our plan to support mental health in the school district. And we're very happy that we could do this. It's to provide support, awareness, resources to inform our parents about what's available. This webinar will be recorded and will be available to people to see when they want to see it. It'll be on our website. We are pleased to have local experts with us to share their knowledge in this area with you tonight. But before we get to their presentations, I would like to introduce Congressman Bill Foster, who is joining us tonight. Congressman Foster is very much a friend of Indian Prairie School District. He has been participating in many events that we've had and participated in going to schools to talk to students. And I know mental health is a concern of his. So Congressman Foster, I'll turn it over to you.
Congressman Foster, can you hit unmute, please?
Well, you know, it's one of the complexities of life these days as you go back to in-person things is that on about half of the speeches you give, you have to unmute and half you don't. And well, first off, just good evening and thank you for having me today to discuss awareness and resources of informed mental health in education. And for those of you who don't know me, I'm Congressman Bill Foster. I'm a scientist and a businessman, and I'm proud to represent the 11th Congressional District of Illinois in the U.S. House of Representatives. Over the past year and 9 months, this pandemic has upended the way our country has approached the relationship between education and mental health. And although the stress has been enormous, throughout this pandemic, we have made incredible strides in lowering the stigma around mental health and seeking professional help when it's needed, but we still have a long way to go. It is so important in this continued time of uncertainty that we are able to confide in those we love and in experts in mental health on ways to manage stress, anxiety, and depression. As each of you are aware, this pandemic has given parents the additional tasks of being a home educator, a study hall monitor, and most relevant to our conversation here today, a school counselor. At-home learning has resulted in massive increases in students reporting anxiety and other mental health concerns. The studies have shown that students feel the pandemic has worsened any pre-existing mental health condition they have, mainly due to school closures, loss of routine, and restricted school social connection. Learning from home was a patriotic necessity to protect our friends, our families, and neighbors from a pandemic that has killed nearly 800,000 Americans to date. We are now faced with the need for increased resources for mental health as we move towards a new normal and a brighter future. We must all do all that we can to make sure that families have access to these important resources for their children. So last month, I was proud to vote for and see pass the Build Back Better Act in the House of Representatives, which included $165 million in funding for mental health initiatives. Specifically, these funds include $75 million for improved infrastructure at the National Suicide Prevention Line, $50 million to strengthen the skills and cultural competency of social workers in addressing the needs of communities of color, $25 million to provide peer-based programs for individuals recovering from substance abuse, and $15 million for Project Aware, a program to educate students on mental health issues. This funding is just the start of moving into a future where our students and you as parents are all aware of all of the available resources for mental health. And I'd like to thank our wonderful moderators, Dr. Adrian Talley, Doug Carius, as well as all of our panelists for all of your contributions on this critical issue. Thank you all.
Congressman Foster, thank you very much for your words and for sharing with us the work that you have done and what is available through our federal government. This is very helpful, and I always appreciate what you bring to the table. I would now like to introduce our panelists who will be speaking with us tonight. We have a good slate of panelists from a variety of backgrounds. And first is Mr. Amit Thaker, is a former hospital executive turned entrepreneur, spending the last decade focusing on the mental health space. He launched ReferralGPS, a service used by many area organizations to help connect people into treatment. We use it here in Indian Prairie. He is a valued district partner and a District 204 alumni. We also have Dr. Laura Langs, is a licensed clinical psychologist with a specialization in child, adolescent, and family psychology. She is skilled at providing individual and family therapy to both youth and adults from diverse backgrounds. She has worked in a variety of treatment settings, including community mental health centers, a specialized foster care agency, public and therapeutic day schools, and a psychiatric inpatient hospital. In addition to her clinical work, she provides trauma training to schools. We also have Dr. Marloes Verhoeven, has extensive experience treating adolescent and adults with a wide range of conditions, including mood disturbances, anxiety, post-traumatic, acute and chronic toxic stress, grief and loss, dissociation, and personality disorders. She also provides training to professionals in the community about trauma-informed treatment, gives seminars about the science of ACE and how to implement this science into practice, and also provides trauma training to schools. We have Ms. Dawn Forkner, who is the District Social Emotional Learning and Wellness Coordinator. She recently transitioned from the role of Social Emotional Learning Coach at McCarty Elementary School. Previously, Dawn was a school social worker at Still Middle School and McCarty Elementary. Additionally, she started her career as a middle school English language arts teacher for 11 years. And we also have Ms. Jessica Torres Proctor, and is the Director of Guidance at the Neequa Valley High School, and is in her 18th year in education, with her 3rd year at Neequa Valley. She has filled roles as a teacher, professional school counselor, dean, assistant principal, and now Director of Guidance. And so we're happy to have them here with their different experiences. And we're first going to begin with a presentation from Mr. Thaker.
Great, thank you, everybody. Again, my name is Amit Thaker, CEO and founder of ReferralGPS, and I just want to start off by saying thank you. Thank you for the district for not only putting this together, but also thank you to all of the parents and the folks that are listening in on us. As you guys know, right now is a difficult time for everyone, right? And it's been a difficult time for quite some time. And it's not just for our students, it's our parents. It's everybody that's on this call has either struggled at some point, some mildly and have been okay during the pandemic, and some acutely that have really had a hard time struggling to this new norm, as we would call it. And honestly, it's things like this coming together as a community to talk about resources and talk about what is available that's going to help us move this needle. So I want to commend each and every one of you guys for spending a little bit of time with us today just to understand what's available, not only from our district, but in our community. And again, thank you for the district for putting something together that brings us all together to share this information. So I want to talk about ReferralGPS, and I don't have a prepared speech here, and I'm a visual learner myself. And so I feel like it would be most useful for me to walk through what this tool looks like and give you a little preface of what it is. So a few years ago, we started partnering with District 204 and many other districts in the area with a basic premise of how do we help when families are going through that mental health crisis and trying to figure out where to go to. How do we help the district have access to that information readily available at their fingertips that they can then help guide families to who the most appropriate person or treatment resource might be in the community? So we launched this online database that gives folks from the school district, student services teams, the ability to sort and search from anything from insurance to age to specialty to location to who's taking telehealth. They have access to this readily available and regularly updated information. And what we found is through the pandemic, although that was extremely useful, a lot of parents weren't necessarily utilizing it. And when I say that, there was a school social worker from District 204 who reached out to me this past summer and said, I know a certain amount of kids that are on my radar, kids that I know that I need to check in with and families that I know that are struggling. But I also know that there's a whole host of other kids that'll never be on my radar. And it's mostly due to kind of the stigma around mental health, or the fact that they don't want to talk to someone who's employed by a school district to understand what their issues are. And what the school social worker said is, I have this great tool, but I can't help the people that don't talk to me. So how can we create access for other folks who may or may not ever find their way into my office, so they can also find some resources in the community? So with that idea, I went back to my team and we sat down and started brainstorming what are ways that we could do it. And we created a parent portal co-branded with the school district and kind of launched it at the beginning of the school year. So far, we've helped over 115 families from District 204 get connected into care within the community. And it's been a great success and something wonderful to kind of work on. And what you hear is a lot of folks that are struggling, not only with their kids, but honestly, a lot of folks that are struggling themselves, struggling in their marriages, struggling in their personal life, their professional life, and really just struggling to ground themselves and not knowing where to turn to. And that whole suffering in silence component has been one of the hardest things for people to battle during this pandemic, particularly when you take away some of the social interactions that we normally had, and then compound that with some of the economic stress that has been happening kind of throughout the area and really throughout our society. So what I want to do is talk about this parent portal and show you guys what it looks like, because everyone on this call and everyone within the district has access to get into this portal and search for resources that are available in the community. And they can search anonymously without putting in their own identifiable information. At 3 o'clock in the morning, anybody has the opportunity 24 hours a day to be able to search for resources and use some of those same filters that the student services team have, except use it in a more easier, seamless fashion. So with that, I'm going to show you my screen here. All right, this is the parent portal. It's accessible by any device that connects to the internet. So whether you're using a phone, an iPad, a desktop, or a laptop, you simply open up a web browser. I tend to use Google Chrome. It's kind of the one that has the least amount of kinks. You simply type in referralgps.com/findhelp/IPSD204, and that link will also come out not only in the chat, but also out after this session, so you guys all have access to it. And when you type that link, you'll end up finding yourself on this screen. And as a parent, if you're looking for resources, you now have the ability to start your search. Now that search is really location driven, but then we have a whole host of other things that go behind it to show you some curated results that allow you to try to reach out and find who might be the best resource. So I'm going to walk through a quick search with you guys just to show you how it works. And then I want to talk about some of the other services that you have available to you. So let's say you're a parent of a 14-year-old who's struggling with anxiety and you have Aetna insurance and you're trying to find a clinician to schedule with. So you'd simply type in here, I'll use 60504, my old zip code there, click find. It's now asking, which of the following do you need help for? And there's a number of issues that are listed here. These are kind of some of the more common terms that are searched on Referral GPS. However, if your issue isn't listed, you have an ability to request care navigation. And I'll walk through what that looks like in a few moments. I just want to walk through this search first. So let's pick anxiety. Then it asks what best describes what you're looking for. And there's a variety of different buckets here, everything from the lowest acuity of care, which is kind of talk therapy, which would be a therapist, a professional counselor, or a psychologist, a medication prescriber, so someone who can prescribe medication for psychiatric issues. So whether that be a nurse practitioner, physician assistant, or a psychiatrist, psychological testing, a dietitian, and then full day, half day treatment is some of the hospital-based care. So some of the more acute patients have the ability to search for that as well, if you think that a more structured environment is what you need, either for yourself, a loved one, or for your kids. I'm going to walk through talk therapy because honestly, that's really where most people start. And probably where most people need to start is from a therapeutic component. So let's start with talk therapy. Do you have a preference of the gender? We'll say it doesn't matter about the gender, I'm open. What's the age group of the person? I think in the example, we said a 14-year-old daughter. So we'll say 12 to 17. Would you consider treatment online? Prior to the pandemic, no one was really doing telehealth, hardly anybody. Once the pandemic brought itself to our doorstep, nowadays almost every practice has some component of telehealth. That being said, not every practice is fully back in office. And so we have actually gathered data of some of the practices and the clinicians in the area that are in office. So you have an ability to search if you really only want to see someone in person, which happens a lot with our adolescents, particularly towards the end of last year, where people were just going through kind of screen fatigue is what I call it. And they really just wanted to talk to someone in person, especially when you're talking about something as intimate as a mental health issue or a substance use issue. So the question is, would you consider someone online? We'll say, sure. Do you need evening or weekend availability? Say I'm flexible. Who's paying for this treatment? And so if you can actually say, I plan on using my insurance, and select an insurance, and there's a whole variety of different insurance plans, from HMO plans to managed Medicaid plans to PPO plans, and just a whole variety of other things, from Medicare to Aetna, everything underneath the sun. So you can pick your particular insurance plan and click next. And now what we're going to do is show you some results. We show basically 9 results at a time of clinicians that meet the criteria of what you've just put in. So clinicians that are seeing people either in person or telehealth, folks that accept Aetna, folks that work with anxiety and that work with adolescents, and that are in the general vicinity of that zip code that we entered. So once you're here, you can look at a couple of these profiles by simply clicking the names. So when you click a name, you'll see, whoops. When you click this profile, what you'll see is the information for that particular clinician that you're then able to decipher if they're going to be a good fit for you. From there, you'll have everything from their phone number of how to contact them, their website. You can even email the practice directly. But let's say, for example, you're looking at these folks and maybe you've read through a couple profiles and you don't think they're going to be a good fit. You have 2 different options at that point. You can click load more, which will load another 9 individuals for you to be able to review. Or you can scroll down here and click request care navigation. So what that does when you request care navigation is you actually have the ability to submit your information over to our team. So this is the only time that you would actually submit, who you are. And you basically be saying, hey, I need some help. I'm looking for something and I can't find it. And so here's my info and here's the situation of what's happening. Can you contact us? From there, we actually outreach. We have care navigators that are licensed, prepared clinicians that outreach to you either phone or email and set up a time to have a discussion with you. Through that triage discussion, we'll determine not only what's the best level of care, but also what are some resources and some best next steps that you can take. At the culmination of that call, if you need assistance with scheduling, we'll also take it to the next step and call practices on your behalf to see what availability looks like, and then come back and give you that information via email or by giving you a phone call, so you can then have that information readily available to take the next step. So what we're trying to do is remove every little hurdle that happens through the treatment seeking process away, right? And make that as seamless as possible so you have your information. Because honestly, at the end of the day, I know I've helped friends and other loved ones that have been through mental health crisis. The last thing I want to do is tell them to call the number on the back of their insurance card, sit on hold for 2.5 hours and get a PDF of 400 people, half of which aren't even on that insurance panel anymore. And that's a real life example. I mean, I've done that with one of my really close friends and I've been through that process. And our whole idea was we need to take out every little hurdle that we found throughout this process and make it as seamless as possible. So that's essentially Referral GPS. And again, this is a service that we provide to all, and there's no cost to this service to any of the district families. We work directly with the district to underwrite the cost of this, to make it available for our community, and would love to be able to extend this out to anybody on the call or anybody that you know that you're connected to that would need help. And as a reminder, your student services team at the district and in your specific schools are an invaluable resource. So if you have the ability and the desire to have a discussion with them, I always advocate for families to do that, to bring them in the loop, because it allows us to have everyone at the table and know what's happening. But I also understand there's particular circumstances where people may not want to do that. So you have these resources available to you, and the school student services team also has a similar resource and a search database for them and an ability to put in care navigation referrals to our team as well. I'm not going to pause here for questions because I believe there is a question and answer portion towards the end. So with that, I'll say thank you for the time and stay on for questions at the end.
Amit, thank you so much. I do want to let people know when we approached Amit about doing this work, he was very quick to say yes. And I appreciate that tremendously. I think he was our first person who said he'd be willing to be part of this conversation tonight. And it really is a great partnership with the district. And the fact that he is an alum of Indian Prairie just makes it all the better. So thank you so much for that information. And he will be around to answer questions that people may have. I now am going to turn it over to two of our Indian Prairie great staff people, and that will be Dawn Forkner and Jessica Torres Proctor, who will talk about resources that are available within the school district. So Dawn and Jessica.
Good evening. Jessica and I are pleased to share with you the district's work with social emotional learning and mental health. Before we begin, we would like to share a little bit with you about the meaning behind the 3 graphics on the screen, as they represent the guiding principles behind all of our work. First, Jessica's going to share a little bit about Portrait of a Graduate with you.
Sure. So, in work with our community, our stakeholders, we recognize that there are skills that students should have to be successful as students and beyond, aside from academics. And in working with, again, our stakeholders, the community, we identified those skills and they are now part of what we identify as District 204's Portrait of a Graduate.
All right, thank you. In the middle, we have the We Are 204 logo. So we know that Indian Prairie is a diverse district, and that's something that we are very proud of, and that we strive to be inclusive and equitable to all of our students, to our families, and to our staff. And finally, we have our Castle wheel on the right. Castle is an organization that we have a long-standing relationship with, who have created 5 principles or 5 competencies that guide our work with social emotional learning, which are self-awareness, self-management, responsible decision-making, relationship skills, and social awareness. So as a district, we use those 5 competencies to drive the direction of all of our social emotional learning and mental health initiatives. Oh, sorry, one sec. All right, Indian Prairie School District 204 is committed to providing proactive social emotional learning and support to all students, from our youngest learners in our preschool to our high school and transitional students, in those 5 social emotional competencies of self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. This commitment is evident in our social emotional learning vision statement, which states, working together, the community of District 204 works with social emotional competencies in order to create a trusting I'm sorry, my screen went blank for a second, I apologize. In order to develop safe and trusting relationships and a culture of acceptance and resiliency. Jessica and I will be sharing a little bit about the social emotional learning opportunities at all levels, as well as the roles and responsibilities of the different mental health staff at each of those levels, and then making connections between our preventative SEL work and the improved mental health for all of our school ages. So starting off with early childhood, Indian Prairie is proud to offer quality evidence-based early childhood education to students. Prairie Children's Preschool, whose logo is in the middle, is our largest site, but we also have school-based sites at Longwood Elementary, Graham Elementary, Gombert Elementary, and McCarty Elementary. Research has shown that children's brains grow and adapt rapidly between the ages of birth and 5, and this is why it is crucial to begin teaching young children SEL skills such as emotional regulation and age-appropriate social skills. So at all Indian Prairie preschool locations, students are provided with daily opportunities to learn and practice those SEL skills. So we follow a teacher-driven universal curriculum that addresses the Illinois social emotional learning standards. Some of the things that our preschool programs do is they use a evidence-based curriculum called PATHS. PATHS stand for Promoting Alternative Thinking Strategies. They support SEL, skill development during their center and circle time, because we think it's important to embed SEL naturally in the interactions between students and staff. They use a pyramid model to build on those skills. And finally, like all of our buildings in the district, we use PBIS, which is Positive Behavioral Interventions and Supports, which is a program that teaches directly different skills and then reinforces them through both intrinsic and extrinsic motivators. Our preschool also has mental health staff available to families and students. They primarily have social workers and school psychologists. And at the preschool level, the roles include supporting behavioral and emotional regulation needs. So when we have a student that's experiencing difficulty, maybe with strong feelings, with uncomfortable feelings, with big feelings, like we call them in preschool, these individuals work with those students about proper coping strategies, calm down strategies, ways to manage those big feelings. They collaborate with the educational teams. So social workers and psychologists work directly with the preschool teachers. They provide parent education and consultation as needed, and then create individual student plans for our students that move to IEPs as needed. So we have a lot going on, even all the way at the beginning at our preschool level. All right, moving into elementaries, you can see we have many elementaries represented by all the different logos on the screen. So Indian Prairie is also home to 22 very diverse elementary schools. Elementary can be a time for parents and or teachers to start recognizing potential signs and symptoms of mental health struggles. These symptoms may look like, and this is not an exhaustive list, but just some of the things that we've seen in elementary: significant and ongoing difficulty focusing, significant impulsivity, significant and ongoing difficulty interacting with peers, significant and ongoing difficulty managing strong emotions, sudden or unexplained withdrawing from others, or significant ongoing feelings of undue anxiety. The key words for these signs and symptoms is significant and ongoing, because most students during their elementary years at some point struggle with some of these. As a parent of 2 elementary students, I can say that. So we don't want to immediately panic or jump to conclusions, but if we think it's significant and we think it's been ongoing for quite a while, that's when we start to think that maybe we have something more going on. All right, looking at our elementary. At this age, it's very important that students receive direct instruction, those teachable moments, modeling from teachers and from other students, and opportunities to practice age-appropriate SEL skills, such as calm down strategies, advocating for themselves, developing empathy for others, and problem solving. To do this, we have multiple strategies. The first is that every single elementary building has dedicated daily SEL time. And although they have different activities that they do during that SEL time, one of the main things they do is a weekly second step lesson. And the second step, again, refers back to some of those CASEL competencies, and those skills are being taught for those competencies. And then they are reinforced throughout the school week. There's a strong focus this year on embedding SEL skills throughout the school day across all of our subject areas. We really want students to have that opportunity to see it modeled, as well as a chance to practice it, so that they don't see social emotional learning in a box during SEL time. And finally, just like the preschool, we do use the PBIS program in our elementary buildings, which again stands for Positive Behavior Interventions. So teaching those behaviors, supporting as needed, and then reinforcing both intrinsically and extrinsically. Now, as we move up in the years, we start having more mental health support. So once again, just like preschool, all of our elementary buildings have social workers and school psychologists. And similarly to the preschool, their roles are to support behavioral and emotional regulation needs of our students. They collaborate regularly with parents to figure out the best plan. And then if we're putting something at place at school, to make sure that that parent is able to reinforce that at home and vice versa. Parent education and creating individual student plans as needed. Now, we've also decided to add more support to our title buildings. And one of those roles is an SEL coach, which is actually what my previous role was at McCarty. So some of the things that we do, and I liken it to a school counselor, but at the elementary level, is that we work with students who need additional social and emotional support. So maybe somebody that needs a little bit extra. We help to create plans for students in crisis. We collaborate with parents to bridge school and home, and we provide parent and staff education on mental health related topics. In addition, our Title I buildings also have Title I facilitators, and they act as a student dean at the elementary level to support the principal. They support students who are experiencing behavioral challenges. Many of our Title I facilitators work out at recess and at lunch to help students with that problem-solving piece, that advocating for self piece, the emotional regulation piece of unstructured times like lunch and recess. And they support the social and emotional needs of all students. All right, now we move into middle school. As we move into middle school, most parents recognize that this is a challenging time for parents and for children. Students need to feel like their voices are important and their ideas are validated, while at the same time they're seeking adult guidance. They seek a sense of belonging, but at the same time want a sense of autonomy. And it's no doubt a confusing time for all involved. So we have our logos of all 7 of our middle schools on the screen. And again, similarly to our elementaries, they're very diverse, and that's something that we're proud of. All right, to support all of our middle school students at this time, the district has developed a plan to address the SEL needs through a variety of modalities. So again, just like elementary built on preschool, middle school builds on elementary. So first of all, the middle school proactively addresses the social emotional learning of students through the implementation of an achieve period. So an achieve period happens every single day. It is a class period that is with lunch, and they have the same teacher every day. And within their achieve period, they have different objectives. They have a weekly second step lesson, just like we do at the elementary level. They have weekly digital citizenship lesson to help with the transition from remote learning to instruction, in-person instruction. There's a weekly executive functioning lesson to help students with skills such as organization, time management, and prioritization. They also include academic enrichment for students that either need additional help or students that may need some differentiated instruction. And there are teacher-led community building activities because we really want our middle school students, although they have a sense of autonomy, to also feel like they belong to the bigger school community. In addition, all middle schools have put an additional emphasis on the following. So we have special weeks where we're focusing on certain things. So for example, we did do a World Suicide Prevention Week in September, a World Bullying Prevention Week in October, Red Ribbon Week, which is a preventative program to educate students about the dangers of using drugs or substance abuse, Random Acts of Kindness, and International Social Emotional Learning Day, which is in March. In addition, all middle school students participate in a 9-week health education curriculum that focuses on physical health, social awareness, and mental health. So some examples of topics that are covered in this health course are stress management, anger management, self-advocacy, and self-esteem. And this happens at all 3 grade levels, 6th, 7th, and 8th. All right, so once again, our support builds as our students are getting a little bit older. So to start with, we do have school counselors. There are 2 individuals at each building who act as your initial point person for concerns related to academics or mental health. So oftentimes for parents, when we are concerned about our child, maybe they're not doing well in a class, maybe we're seeing significant and ongoing changes in their behavior or with anxiety or stress, usually the first person we want to start with is our child's school counselor. In addition, we have parent and community engagement specialists. This was a position that was created as we transitioned from remote learning to in-person learning. So it's a liaison between home and school, and they provide parent education and support, and they've been a huge blessing to our district. The Title I buildings also have SEL and academic coaches, and they work with and develop plans for students who may need additional academic and or SEL support. And finally, just like our preschool and our elementary, we also have social workers and school psychologists at all of our buildings. And they provide school-based non-clinical support for students with significant needs. They work directly with special education students, and they do parent consultation and education for accessing outside mental health education supports. All right, and I'll hand it over to Jessica because she's our expert on high school.
Hi, so our high schools are here on the screen, represented by the 3 logos: Wabanzi Valley, Metea Valley, and Neuqua Valley. And so when it comes to the high school, you know, we definitely prioritize and have an emphasis on teaching our students the SEL. We have a committee of teachers, administrators, and anybody who, you know, wants to be a part of the committee to really help us look at what our needs are and to plan to provide students, you know, the skills that they need to be successful. So similar to elementary and middle school, at the high school level, we continue to prioritize teaching students about SEL. And so we have dedicated SEL time at all 3 high schools, look a little different at each. However, we all do monthly lessons that really come from what we call our School Connect curriculum, as well as teacher lessons where they feel the need is for specific students or classes. We continue to reinforce habits for success, such as advocacy, resiliency, study habits and preparation, school success skills. More than ever, as you know, with COVID and its effects, we feel that really emphasizing the habits for success is a priority because a lot of students forgot what those look like. So we in every class, every period, teachers will focus on teaching those habits for success as well. And we try to provide students, you know, mental health focused clubs or extracurricular activities that will really help promote the mental health to students. We have clubs such as You Matter, Mental Health Matters, Yoga Club, among many others. Again, just trying to make them a part of teaching students about mental health and having them take a lead in that as well. When it comes to support from the social work and counselors, we have groups that are led by both groups that really focus on the areas of need. So we try to survey our students to see where their struggles are so that we can provide the appropriate supports. And so some of the groups that we run are like grief group, mindfulness, things that have to do with prioritizing their mental health. So anything that we find that students communicate an area of need. We also have a mental health awareness week where we educate and promote positive mental health practices. And then again, looks different at every high school. But during that week, we do presentations or student-led activities to again, just make everybody aware. And then also we have a partnership with 360 Youth Counseling Services who help us support students in our building more in the clinical aspect. As far as mental health staff in each building, we do have school counselors similar to middle school. We have school counselors who are the initial point person between the teacher, student, and parent for academic specifically, but also when it comes to the social emotional health of students. So again, teachers, as mentioned before, teachers and parents, school counselor would be the point person to reach out to get the support or be directed to the appropriate person for additional supports. We have a social worker and psychologist who provide school-based non-clinical support services for significant needs, who also work directly with special education students, and are a liaison to consult about specific areas of need for students, and to also provide information about outside mental health supports. And then lastly, we do have a mental health coordinator in each high school. And this person specifically works with those students who, for some reason or other, have needed to receive support outside of the high school. They work closely to support students who are experiencing significant mental health crises that result in being placed in an outside mental health program. They act as a liaison between student, families, school staff, and outside mental health programs. And they develop an individualized transition plan for return to ensure continuity of care, including counseling support, advocacy, academic support, and executive functioning and prioritizing of their work. So this is what we call the high school. I'm now going to turn it over back to Dawn for the learning opportunities for staff.
Thank you. All right. So we've talked a lot about the different programming that we use and the different ways that we support students. So to better equip staff with the tools to work with the mental health needs of students of all ages, the district offers a variety of mental health focused professional learning opportunities to all of the staff. One example is book studies that focus on a variety of mental health related topics such as trauma, anxiety, depression, and emotional regulation. Book studies are a great opportunity for teachers to network and to learn classroom strategies from district mental health professionals. Above are some examples of book studies that have been offered this school year. So we have done Fostering Resilient Learners, Strategies for Creating a Trauma-Sensitive Classroom. We then did the follow-up book, Relationships, Responsibility, and Regulation, Trauma and Best Practices for Fostering Resilient Learners. And coming in the spring, we'll be doing Connections Over Compliance, Rewiring Our Perceptions of Discipline. And these are voluntary book studies. They are done at night via Zoom, and we usually get great participation and lots of good discussion about these topics. Right. In addition, we also have something called affinity groups. Affinity groups are small groups that meet on a regular basis to discuss specific topics. These groups offer support, resources, and new ideas for educators of all experience levels. Above are just a few examples of mental health and wellness related topics or affinity groups that we have. So we have BEST, a lot of them have acronyms, Latinx educators, Men Who Teach, New Educator Connections for our first year teachers, PRISM, which is our LGBTQ and Pride and Allyship, Team, and Transform. Candy, we're missing a slide for some reason. But that's okay, so I will just talk about it. All right. On our next slide, for some reason that I don't have, we have a district initiative called Youth Mental Health First Aid. It is a program that is designed for all staff members, but also parents and community members who work closely with students. And it is an initial response to a student or a child in crisis. I liken it to injury first aid in the sense that it's not long-term or ongoing treatment or therapy. Rather, it's how do I respond in the moment when a child comes to me in a mental health crisis. So it is an 8-hour training. Oftentimes we offer it as a 6-hour in-person training and a 2-hour online training. So here are just a few of our youth mental health statistics. It says currently IPSD 204 has 124 staff members from all levels who have been certified. Currently, we have 11 certified instructors who lead the training sessions. On our January 18th SIP day, our school improvement day, we'll have 64 more high school staff members who will be youth mental health first aid certified. And youth mental health first aid was offered to high school parents this past December. And we had parent volunteers from all 3 high schools who became youth mental health first aiders. We are also intending to offer additional parent sessions in the spring. All right, lastly, Jessica's going to talk a little bit about our mental health page.
So, for any resources, sorry, it's pausing. I apologize. For resources in regards to mental health, whether it's crisis lines or just, resources within the community or anything of that nature, we do have a link here that will take you to that page and will provide you with that information. In addition to that, however, each school does have a resource page under the guidance page for, again, all 3 high schools that gives you information specific to the high school with regards to any resources within the building and also in the community. So again, just very useful information that is accessible at any point in time that can help you navigate and just find some resources to help your child as well.
All right, that is what we have to share with you tonight about the district level support. I will turn it back over to Dr. Talley. Thank you.
Thank you very much. I hope those who are listening can hear all the resources that are available in schools, the people who are there, who are in place to ensure that our children are doing well. And if there are questions, the people to whom you can reach out and say, I need help. They are there to support you, support your children. Now we're going to have our two therapists, Dr. Laura Langs and Dr. Maluz Verhoeven. They're going to talk now and share their information about resources and what parents can do. Thank you.
Thank you so much, Dr. Talley. I'm going to share this slide with you. I hope you can all still see me. I kind of want to back up a little bit here and share with you how we got to this point. I really appreciate Dawn and Jessica's knowledge here and sharing of resources of what's available in the District 204 community. Unfortunately, despite our best efforts, sometimes the unthinkable happens. And that was the case a couple of weeks ago in one of our high schools at Niqua, where there were 2 deaths by suicide and 2 violent deaths by in the Astroworld concert that really just rocked the 204 community. And in direct response to that, we reached out to the district and said, okay, how can we help? Because we were getting a lot of questions in the community. And the 2 most important questions were, how can I support my child through this really difficult times, especially if they've been directly affected by it? And is my child at risk for suicide? And what are some warning signs and how can I prevent that from happening? So we're really going to zero in and focus on that a little bit more in our presentation within the broader context of mental health. If there are people coming to our presentation that have been directly affected by that, we would also extend to you our deepest condolences. A quick trigger warning too, as we are headed into the presentation, there will be a lot of talk about mental health, substance abuse, trauma, and suicide. So please take care of yourself and take a break if you need it. And with that, I would like to introduce to you a model of the effects of exposure to suicide. In therapy, we most often see people in the innermost circles, the suicide bereaved, short and long term, but many more people are affected. And I believe that that might be a reason why so many people, and I thank you all for attending tonight's panel, because everyone noticed the ripple effect of how this has affected our community. A question that has come up is, how common is suicide? And you might be surprised to learn that about half of the US population knows someone who has died by suicide, and about 2/3 of all of us have known someone who has either attempted or completed a suicide over the course of your lifetime. Despite those really high numbers, there is an underestimation in the general public about how common suicide is. It is much more widespread than people believe. And one of the reasons for that is that there's still stigma and shame around the topic, so we don't really talk about it. Putting this in perspective in terms of youth mental health problems and suicide, and these numbers are pre-pandemic, as Congressman Foster and others have pointed out, the pre-pandemic numbers don't really reflect anymore where we are today. But I'm going to go over these numbers that are pre-pandemic. So before the pandemic hit, about 20% of teenagers had a serious mental health problem at some point in their life. That's 1 in 5. Half of all lifetime mental health problems begin by the age of 14, and 75% begin by the age of 24. So it's crucial that we get the youth the help that they need. Suicide is the second leading cause of death in the United States among young people ages 10 to 24, going back to that idea of how common this is. Pre-pandemic, again, about 1 in 6 high school students nationwide seriously considered suicide, and about 7% made an attempt. At most risk are people that live in communities of color and also LGBTQ youth. They are almost 3 times as likely to consider suicide, 5 times as likely to attempt suicide compared to heterosexual peers. 30 to 50% of transgender teenagers have reported a suicide attempt at some point in their lives, and almost half of people who died by suicide had a diagnosed mental health disorder. So when we look at those statistics, we might wonder what can be done to prevent that. We really need mental health treatment. In 2016, though, only about half of US youth aged 6 to 17 actually received that kind of treatment. So moving forward then from pre-pandemic to our current situation, in October of this year, the American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry, and Children's Hospital Association all declared a national state of emergency in child and adolescent mental health. Hospitals were shocked to report a 45% increase in the number of self-injury and suicide cases in children as young as 5 and between 5 and 17-year-olds compared to the same period 2 years prior. And so, and what I said earlier too about LGBTQ youth, the same is true for the disproportionate toll mental health and self-injury and suicide risk has on young people in communities of color.
Hey, Marluce.
Yes.
Oh, yeah, sorry, Marluce, the PowerPoint isn't showing. I don't know if your screen sharing's off.
Showing? Oh, I'm so sorry. I'm glad you told me. Hold on, let me, okay.
There we go.
Is that better?
Yes.
Yes.
Okay, I am so sorry. Maybe I should.
There we go.
Yeah. Okay.
All
Let
good.
me show you what you missed. This was the this was the slide about the model, and then I went over how common it is, the pre-pandemic problems, the national state of emergency, and that lends us back here. I apologize for that. I'm glad you told me, Laura. What is really important to understand here is that suicide is incredibly complex and there is no single cause. It is frequently the result of a combination of risk factors that include a history of mental illness or current mental illness, especially mood disturbances like depression or bipolar disorder, severe anxiety or panic disorders, trauma or PTSD, and substance abuse. That is typically seen in combination with an experience of intense psychological pain, despair, and hopelessness. There might be environmental stressors going on. There is often a filled sense of belonging and a perceived burdensomeness that others will be better off without me. In addition to these risk factors, it is also really important to assess if there is access or means to a way to die by suicide, such as firearms, suffocation, or poisoning and overdosing. In terms of substance abuse, we need to watch out the most for alcohol use, because alcohol actually is a depressant to the central nervous system. It has a disinhibiting effect, and it also gives, we kind of call that in colloquial terms, liquid courage. And it takes quite a lot of courage, as odd as that might sound, to overcome that self-preservation to actually harm ourselves. So be especially attentive if your child might be exhibiting symptoms of using alcohol. So as you can see, the combination of all of these risk factors might lead to a perfect storm, and that might then result in a suicide attempt. The effects of being exposed to someone who may have attempted or has died by suicide is the closeness or the proximity to the deceased person. Another effect is that when a suicide happens, it violates a lot of assumptions that we have about the world we live in, about our family and friends and the relationships with them, and about our safety. Some of those assumptions might be beliefs that we have about death, about our own invincibility and our own mortality, and the idea that this doesn't happen to me, or I could have done something to prevent the suicide. That is something that we hear a lot. It's kind of like a false sense of control that isn't really true, but we would like to believe that we have some power and control in the matter. In people who are already struggling, for example, if there is a mental health diagnosis, a completed suicide might also have what we call a role modeling effect. And some people call that suicide contagion. This is especially true among adolescents. So it's really important that we assess for that. Common responses when someone has experienced a suicide loss is asking why. Why did this happen? People want to make sense of what happens in the world around them, including suicide and death. That is a common, normal response to suicide loss. Another very common response is the sense of responsibility seeking, either blaming ourselves or blaming others. For example, your child or yourself might ask yourself, what could I have done different? Or what could the school have done different? Again, that has to do with that sense of power and control that we often don't have. And also because we want to have simple explanations for a really complex phenomenon. In addition to asking why and feelings of responsibility, a lot of people experience a sense of trauma and helplessness that can look like shock and horror, and then may look like fight, flight, and freeze responses. Fight being becoming very angry and argumentative, even hostile, aggressive. Flight is more like running away, not wanting to talk about it, avoiding the topic. Freeze responses is really kind of like withdrawing. All of those responses are common. In addition, anger can happen, especially if there is a sense that the suicide was some message from the deceased person, or people can be angry that the person rejected and abandoned them. Sometimes people experience relief, which is then often followed by guilt about the end of suffering. This can be true if someone dies who has been abusive or a bully, for example, or when someone has had severe bouts of depression or illness, and then there can be a sense of relief too that the person is no longer suffering. Another common response is a sense of shame. And unfortunately, this is rooted in history, because in the past, suicide was considered to be sinful for a long time. It still is in some cultures and religions, and suicide was previously treated as crime. Therefore, the term committing suicide is something that we try to change, and I will show you in the next slide what that might look like, because when you think to yourself, I commit something, the first thing people think about is I commit a crime or I commit a sin. Suicide is neither, but so we're trying to get rid of that word commit there. There is still considerable stigma, though, around suicide and suicide loss, and that might lead to a sense of shame. As a result of that, there's also social ambiguity. A lot of people will ask us what to do with, the siblings or the parents of the person who died by suicide. No one knows what to do next. how to approach the family, what's appropriate, can we talk about this, can we not? And unfortunately, the not knowing leads then to a lot of social isolation in the people who have experienced a loss, even in the ripple effects further down the line that I tried to show you earlier. In addition to suicide loss as part of the bereavement, there might also be people's own suicidal feelings. Why go on in the face of this extensive loss, as well as a deep sorrow and grief and yearning for the deceased. It's very, very common also to experience either very intense and changing emotions, or the opposite, feeling very numb and disconnected. Here's a quick slide about why language matters. I explained that previously. So avoid saying commit suicide, instead say some of these other things. If someone you love has experienced a suicide loss, a lot of parents ask this: how can we help our child, our student? The most important thing you can do is to create a safe harbor and secure base, so that any child can find adult support. It's really important that when they do that, that you can first soothe and help regulate emotions. Something that I like to say in a lot of trainings and interactions with my clients is no one in the history of calming down has ever calmed down by being told to calm down. In order to help calm people, you have to be calm. And that means that you as a parent or an educator or support staff need to be regulated yourself, so that you can help calm and regulate the children, the students, your children as well. Keep in mind there are the 3 R's: regulate, relate, and reason. What that means is first, both you and your child needs to be regulated and calm. Then relate to them. That basically means, can you show compassion? Can you relate to them? Can you validate how they're feeling? And only then can you reason and come up with solutions. It's really important to communicate that you understand them and that you can provide compassion and empathy and be attuned to what they need. Help them reflect on what happened, what it means, how you can cope, and based on the previous slides, what's normal. Respect the grieving process, because even though there are many common responses, everyone's grief is unique. There is no timeline, and everyone's grief process looks differently. And continue to check in with your child. Offer support, especially at difficult times of year. We're coming up on the holidays. There might be a birthday. There might be other important dates, the date of their death. Pay attention also to what the body knows. I always tell my clients the body never lies, because sometimes we're not even aware of certain anniversaries, and yet our body can really feel and remember it. If you need to have help from a mental health professional, you can do that by using Referral GPS. Thank you for that, Amit. And also, you can connect with survivor outreach programs. I've listed a couple here on this slide too. They are more peer support and volunteer supports, but they're excellent in providing help there too. This quote here says, some things in life cannot be fixed, they can only be carried. It reminds me of what a man in a suicide loss support group said. He said, I'm carrying the boulder of this loss. And some people believe that, the goal of grief is that I could put down the boulder, but it's more that I learn how to carry it. If I need to get stronger and I need to get strong support around me to carry it, but I will never be able to put it down. I need to, live through it. So I'm turning it over to Laura, who will talk much more about support strategies and warning signs.
Okay, thank you, Marloes. And so part of community healing and learning how to carry the grief that your community is experiencing, regardless of kind of the proximity at which you might find yourself connected to recent suicide losses, excuse me, part of that healing and part of learning how to carry that is also learning and finding ways to prevent these things from happening, to help all members of the community, students, parents, staff, be able to know that there is hope, even though it may not feel like it in the moment. So what you can do as parents is knowing these most common warning signs of suicide. So things, of course, most blatant would be if you hear your child or a student talking about wanting to die or kill themselves. If you end up finding internet searches about different ways to kill oneself, students or kids talking about being in just feeling like unbearable pain, like they're trapped, they don't think there's anything that they could do, or making statements that imply that they're a burden to others and that maybe people would be better off if they weren't here. Those are huge red flags to be able to talk with your child, get some more information, and then be able to get your child some help. And we'll talk about exactly how to do that in just a little bit. Also, starting to use a substance isn't necessarily a red flag in itself, but especially if you notice a marked increase in substance use or alcohol use for your child, especially like Marlou said earlier, with alcohol, that can really impair one's executive functioning and kind of lead to some more problematic behavior. Looking, like I said, online searches, if you notice any like significant change in behavior, but particularly anxious, agitated, behaving recklessly, much more so, giving away prized possessions is a big one as well. Calling or messaging people, saying goodbye, changes in sleep, withdrawing or isolating suddenly, more so than the average teenager would. But you would also see similar signs like this even in younger children. So please remember, even though we might be talking about this in the framework of, or an assumption of teenagers, please know that unfortunately, junior high and even elementary students may have times where they could start feeling this way. So also kind of keep your ears open and don't just assume that because your child's in elementary school that they might not, that they would be okay even if they were saying things like this. Extreme mood swings, talking about seeking revenge. And then I have this one bolded, a sudden relief or improvement in mood. So what that means is if your child has been struggling for a while, has been very depressed, and then all of a sudden seems completely fine, that is a red flag in itself. Oftentimes when people are in a very low state of depression, there's just this lack of energy to do anything or to carry out a plan. But oftentimes what you'll see, if people actually think through a plan and they are going to do it and it's like premeditated kind of thing, they may experience a sudden uplift in mood. So that can be a sign. So just look for that. And particularly these risks increase when the behaviors are new, increase significantly, or if they appear to be related to some situational factor like a loss or event. Okay, I encourage everyone to go to this website of hashtag be the one to. It's wonderful, and it goes through these 5 action steps in great detail. These are action steps to remember of what you do if your child or anyone, a friend, whomever, you think they may be at risk of suicide, specific things that you can do to significantly reduce the likelihood that they may try to take their life. And also on the website for each step, it actually goes through and gives you the evidence base and with links to actually read the research yourself. You're interested in that too. So I'll go through these really quick, but I believe you'll have access to the slides and the links, so you can revisit this and keep it in case you need it at any point. So the first step is even just asking and being very direct, asking your child, hey, I noticed you've been struggling. Are you thinking about suicide? It's a very, very common misconception that asking someone about suicide would actually lead them to start thinking about it more or lead them to actually attempt. That is absolutely not the case. It actually reduces the risk. So even though it's very uncomfortable or even distressing to talk about, it's extremely important. Please don't promise to keep thoughts of suicide a secret. Sometimes kids will ask that. And really listen, respond with empathy and non-judgment, especially if your child's coming to you and saying, hey, like, I'm thinking about suicide, or you ask them and they say, yeah, I've been thinking about it. That is a terrifying moment for a parent. So knowing that, trying to, remain as calm as possible and just be there for your child. Listen before you jump to, what are we going to do about it? We want to be there first. Okay, so step 2, keep them safe. So you're going to ask very detailed questions, such as, do you have a plan for how you would kill yourself? Have you taken steps to make that plan happen? When are you going to carry out that plan? Again, it can be extremely uncomfortable and upsetting to have this conversation, but when you're able to ask these questions in a straightforward manner, in a non-judgmental manner, it shows your child that you're concerned, that sometimes people feel this way and have these thoughts. You're here for them, and you want to know how exactly you can help best. Remove any means of harm immediately if they talk about any particular means that they were thinking about, or things that you think they may have access to that, if they're thinking about suicide, would not be good. Remove them. So things like knives. Particularly, please make sure that there are no firearms, that your children have access to, or know how to unlock, those sorts of things. But especially if your child has been talking about suicide, remove any firearms. Call the mental health provider or the pediatrician for some guidance if they're already getting some services. You can always call the suicide prevention lifeline, or you can text that number, text home to 741-741. That's the crisis text line. You don't have to be the one in crisis yourself. You can say, hey, my kid just told me that they're suicidal. I don't know what to do. Can you help me? And they will walk you through and help you. If the risk seems imminent or you're just not sure, err on the side of caution, stay with them. Don't leave them alone, or have them with a trusted person, and either take them to the nearest emergency department for an evaluation, keeping them on the phone if you're not with them so you can get there, and if needed, calling 911. Make sure to keep that conversation going, even if there's no intent, meaning that they haven't been thinking about it. Maybe they're just saying, like, I just don't want to be alive anymore, but nothing, or I can't do this anymore. I'm just really tired. Those sorts of statements, still very concerning, but fortunately hasn't taken that next step to planning, which is good, but it's still a sign, okay, your child needs help. Let's continue the conversation. I want to learn more. Okay, and then I do have some advice here for youth or non-caregivers. So if your child comes to you and says, hey, my friend is struggling, what am I supposed to do? We've got those things right there, including if they see concerning posts on social media. Okay, step 3, important, just being there, spending more time with them, trying to check in any way that you can. Again, listening and empathizing without judgment. Ask how you can help. And a lot of times when you ask somebody, how can I help? And they are emotionally distressed or depressed, they might just be like, I don't know. I'm so overwhelmed. I don't know. And even trying to think about how somebody could help them adds to the overwhelm. So if that happens to be the case, or they just don't respond, you can try to offer some ideas, but ask them first what would be helpful. And make sure whatever you offer, you're going to follow through on. So don't promise to do something and then you're not going to. And connectedness and a sense of actually not being isolated, being with someone is a huge protective factor against, depression or suicide, those sorts of things. So just being there, spending time with somebody and letting them know you care is a huge protective factor. Okay, help the person, so help your child or whomever is struggling, connect to the appropriate resources. So making sure, all your kids know, hey, if I'm not around and you need some help, the lifeline or the text line is always there for you. It's always there for you as parents too. Engage kids in the process of finding a therapist and selecting. So I have plenty of people that have told me like, hey, we went online, did some searches. I narrowed the list down to like 5 people or 3 people. And then I have my kid like select, or they kind of interviewed around sort of thing, because a really important point of therapy is that relationship between the child and the therapist, because your child has to trust the therapist. So if something's not working out, the therapy is not going to work. So involve your child even in the selection process if they want to be, and then help create a safety plan. So really this would just be something like helping or coming up with a list of like, how does your child know when they're struggling, or what leads to them getting to that suicidal place. Listing preferred calming strategies. So they've got it right there. Like if I am feeling incredibly anxious or about to have a panic attack, here are the things that help me calm. The names and contact information of 3 to 5 safe, trusted adults and friends that they can reach out to for help. And this hopefully would include what some people refer to as the 3 a.m. friend. That's a name and contact information of a safe and trusted person who is most likely to either pick up the phone or respond to a message, even if it's at 3 a.m. That's going to be kind of like a go-to person, because oftentimes people struggle the most with thoughts of suicide, anxious thoughts, those sorts of things at night. And 2 apps, the My3 Support Network app and the Virtual Hope Box, are great apps that actually walk you through the safety planning process that you and your kids can have on your phone to access at any time. Okay. Here we list some very helpful 24/7 mental health crisis supports. All the information is right here for your reference. And I know we are about out of time, so I just want to quickly end with the step 5. Make sure you follow up. You're not just going to check in with your kid once. This can be an ongoing conversation and help them feel connected and build that trust. Okay. We have listed here, so you can go through this on your own to look for signs that maybe feeling stressed or overwhelmed has crossed the line into just being too much, and perhaps some professional intervention is needed. There's a long list here. Okay, here are some ways to get help, including Referral GPS. Okay, I won't go super into this right now, but we can all improve our mental health by working on what Nadine Burke-Harris says are the 6 areas of stress: health, mental health, mindfulness, healthy relationships, sleep, nutrition, and exercise. Focusing on how you can improve all 6 of these areas in your life will help you be able to manage whatever stress comes your way. Okay, and then the next few slides come from Seize the Awkward, which is great, which is just about, conversations about mental health with your children or just with anybody are awkward. That is okay. Let's seize the awkward by, here are some conversation starters that can be just really helpful so you know how to have this conversation. And of course, you're not just going to start it, you're going to continue, listen, avoid jumping to giving advice, let them know their feelings are okay. And it's okay to feel how they feel, and make yourself available. And then afterwards, especially if they're not responsive to what you're saying or just being there, don't give up. Also, if you're struggling to find a mental health professional, which can be difficult, especially now because there's such a huge surge. Please don't give up. You never know that you'll call and somebody will end up having an available slot. So please don't give up. And we have some more information for your kids if they're helping a friend. Okay, and I encourage you to check out these websites. There's some really great and helpful information. That's where a lot of our information comes from too. Okay, so thank you so much, and I'll turn it back over to Dr. Talley.
Thank you so much, both Dr. Verhoeven and Dr. Lang. I just really appreciate all that you shared. There is a lot of information there, a lot of great information, and I hope our listeners are able to pick up on it. And remember, this information, this recording will be on our website and available for people. We do have some questions that we want to try to go through right now. And so if you will bear with me, question 1, I'm going to turn this over to Jessica Torres Proctor, and the question reads as follows. By the time some students reach high school, they feel anxious and under stress. My question is, when it comes time to choose courses, wouldn't it be a good idea for a counselor to ask the student how a regular day for him or her is?
Sure. So I think it's a great question because we have this conversation all the time. When we meet with students to talk about course selection, because we know that, our students are overachievers and they really want to do it all, right? And their concern is college. And so we have those conversations about, a healthy balance, taking courses that you enjoy that are not necessarily AP courses or honors, but yet also challenging themselves. So it is difficult for students to find that balance. In addition to, having their parents wanting them to take specific course loads. So there are conversations that we have with students all the time. And we always, continue to send a message of a healthy balance that includes challenge, but yet also something that they enjoy and something that is not as rigorous as, some of the other courses they take.
Wonderful. Thank you very much. Our second question, I'm going to turn this over to Dawn Forkner. Dawn, how can the district improve lunch times and recess? As a way to deal with stress, students need free time outside their building. They need recess, and in addition, they need good meals.
Absolutely. And I agree. One of the keys to stress reduction, one of the keys to positive mental health is nutrition, as well as physical activity. So at all of our buildings, we of course have our scheduled recess. And during that time, there's often choices between adult-led structured activities, or maybe a student that would prefer to have something that's led by a staff member. But we also offer those unstructured play opportunities as well. In addition, many, if not all of our buildings offer recesses or mini recesses throughout the school day to give the kids those sorts of movement or body breaks that they need. It's often accompanied with their snack as well as in-class brain breaks, where the kids get up and move. Sometimes you'll hear kids talk about like go noodles, which I know my own kids at home love. And I know when I worked in the elementary building, the kids really enjoyed those as well. And of course, at lunchtime, we always encourage the kids to make positive food choices. Our lunches are served with fruits and vegetables, and we encourage the kids, of course, to eat them. We encourage parents at home to be packing healthy snacks and healthy lunch items.
Good. Thank you very much. This next question I'll answer. The question is, why does it seem as if schools are not transparent with information when there is a student suicide? So whenever there is a death of a student, of a staff member, principals reach out to the family. We ask the family members, what are we able to share? That's a very important question, because there are some families who do not want us to share much of anything, whereas other families want us to share everything. And so it is not by any means that we aren't being transparent. We are honoring the wishes of the family of the family of the person who has died. And so the letter that goes out to the community is crafted in such a way to respect the wishes of the family. And what we say to people in the school is also to respect the wishes of the family. So that is why that information may not be said. It's because of what the family has told us that they're willing to allow us to share. And it's important that we respect them based upon what they've asked. Dawn, I'm going to turn this back over to you with a question about what is positive behavior intervention?
Sure. So that refers to, I mentioned in my presentation, PBIS. It's Positive Behavior Interventions and Supports. And it's actually a nationwide program that our district has adopted many years ago. And what it is we take a look at our buildings, and they're done on an individual basis. And we identify 3 universal expectations for all of our students. So for example, at a building that I was previously at, it was be safe, be kind, be ready. Because we decided those were the 3 most important things we wanted every student in that building to do. And then we developed lessons for that direct instruction piece centered around being safe, being kind, and being ready. So maybe the lessons were keeping our hands and feet to ourselves. Maybe the lesson is on including others at recess. Maybe the lesson is walking quietly in the hallway so we're not disturbing other classes. So we teach these expectations explicitly, and then we reinforce them. A lot of our buildings have ticket systems or token systems. If you have elementary students, sometimes they call them pride tickets or Eagle Bucks. And then they trade them in for some sort of goal that was set by the building, because we always want to make it both classroom focused, but also building focused. And when we reach those goals, we have building-wide celebrations, because we always want to reinforce to the kids that we're proud of them. We want to keep it positive instead of punitive, but we also want to make sure that we're teaching those expectations so that all of our students are being productive learners.
And Dawn, I'm going to just add one more thing to about PBIS. A lot of times it's about retraining the adults, having them look for, as you mentioned, those positive things that our children are doing and they do well. And I think we want to just keep that in mind. This PBIS is about looking for those things that our children are doing well, and celebrating that work.
Absolutely. Like I said, the goal is to be positive and not punitive. The goal is to be looking for the good in our students. The goal is to be reinforcing every time I see you doing that expectation, with whether it is behavior specific praise where I tell you exactly what you did well, or it's giving you one of those tickets or bucks or whatever the token system is.
Good. Thank you. So we're coming up to 8:30. We have about 2 more minutes left. I'm going to say this to sort of summarize for everybody. This is important work that we are doing here and providing this information to you. This, as mentioned earlier, we did unfortunately have 2 students who died by suicide at Neuqua High School. And we know that providing information to you, the community, our parents, is important so that you know what to look for. We also know it's important for you to know what resources are available in our schools. And has been shown tonight, there are a lot of resources. We also have a lot of resources in our community. And I want to thank everybody tonight who has participated in our presentation. We are here to respond to you. We're here to provide resources for you. Look on our website for the information that we've talked about already and for this video that will be put there for you to have. And finally, I will say, know that the schools are here for you. The people in the buildings are here to respond if you have questions. We did something about this last year about stress. We're doing this now about mental health. We want to serve you, and we thank you for participating and listening tonight. Have a good evening, everybody.